Okay, all right. Today, let's dive into how to treat acute bronchitis versus chronic bronchitis. I did a video about 6 months ago, I think, on acute bronchitis, and I want to give you a little more update because many people suffer from this, especially during the winter time and sometimes in the springtime. Okay, this is what you need to have at the bottom of your mind. This that acute bronchitis. Sometimes you can have the cough up to about 3 weeks, sometimes more. But for me, if a patient comes to me and they have the cough and I made a diagnosis of acute bronchitis, if I treat them symptomatically and the cough is not improving after 3 weeks, yeah, I would always will send them to get an X-ray. Okay, you don't always need an X-ray, but if the cough has prolonged that much, especially if it's interfering with your sleep, then after 3 weeks, if we tried all the other symptomatic management, then I will get an X-ray. Okay, but the things you have to the things you have to take home is this: number one, you don't need antibiotics for acute bronchitis unless you have pertussis or what we call whooping cough, and you really have established that you had a contact with somebody who had a whooping cough or pertussis and you're coughing, then we'll treat that with a macrolide. Okay, we'll treat that with antibiotics. Or you are a high risk person, somebody who has like congestive heart failure or have an asthma or have COPD and they're coughing, they're producing a lot of sputum. When that happens, okay, then I will give you antibiotics. You need antibiotics. Otherwise, you don't need antibiotics for acute bronchitis. The second take home is that you don't need albuterol, the beta agonist. You don't need a bronchodilator. The only people that need the albuterol or the bronchodilators are asthmatics or people who are wheezing. If they're wheezing, then a beta blocker will help. I mean, the beta agonist inhalers will help. But most people do not need that. And so if you go to your doctor's office and they offer you that and you're not wheezing, it's just an acute bronchitis, you don't need that because you're only going to get more side effect taking those medication and inhalers. What about steroids? No, you don't need steroids either. And these are things that patients come to the office and they want them because some doctor has given it to them in the past. But the most recent studies and the most recent recommendation for acute bronchitis, which is, like I said, 95% of the time is caused by a virus, is that they have to take it course and you get better, with time, increase fluid intake. Sometimes you can just, if the cough is really bothering you at night, then maybe taking the Benadryl, even though there's no really studies, it's just going to make you sleep more and so that your cough is not keeping you awake. All right. So you don't need steroids. You don't need a bronchodilator. You don't need antibiotics. Those do not kill viruses. Okay. The other one is expectorants and mucolytics, all these cough medicines that people take. About several years ago, the American Academy of Family Physicians did a study where they believe that if you combined guaifenesin and benzonatate, it can decrease the length of the cough. Now, the more recent studies have been proven that that was the one of the school of thought in treating acute bronchitis in the past. But the most recent studies do not support that. So even though your doctor can prescribe that, in my previous video, I think I mentioned that, but the most recent study actually doesn't support that. Okay, so you need symptomatic treatment. Okay, symptomatic treatments is focused on what, like drinking a lot of fluid. If you have pain, you can take maybe some ibuprofen. Those are all like symptomatic treatment. But the most part of it, it's those who take their course. Now, if you have chronic bronchitis is people who have, cough with production of sputum consistently for about 3 months, consecutive months. Okay, they have chronic bronchitis. These people cough all the time. Okay, smokers can have that kind of thing. Or sometimes people just don't smoke, but they have chronic bronchitis. Now, if they have chronic bronchitis and they are producing a lot of sputum, all right, or they have acute exacerbation of it, they're wheezing, that kind of thing, then antibiotics will be indicated. Some steroids will be indicated if they're wheezing, like people with COPD, when they come with acute flare, then in those patients, yes, you can give them antibiotics. or you can give them steroids, and even bronchodilators will help in those people. But cough medicine did not really help in those people. So people who have chronic bronchitis, yes, they will benefit from steroids, from antibiotics, and from bronchodilators. So that is the way you should be treating people who have different kinds of bronchitis. So if you are suffering from a cough right now and it's past 3 weeks and you are still coughing, you've tried everything and your doctor has even prescribed antibiotics for you, they're actually doing harm because that antibiotic is not going to help you. You need to find out other reason for the cough. Is it really an acute bronchitis or a different kind of pathology giving the cough, like acid reflux, where people cough mostly at night when they're sleeping, the acid surge and they start coughing. If you have that kind of a cough mostly at night, you may be having acid reflux. So you should, pay attention and go to your doctor and do a different mode of treatment. Or if you have allergies, allergy season, and you're coughing a lot, that may not be a bronchitis, so you may need a different form of treatment. Or if you're having dry cough, you lay down, you're coughing a lot, and maybe you cannot even lay flat on your bed, you may not really have bronchitis. Maybe that could be your heart, could be a cardiac cough. So again, if after 3 weeks you are not doing well, I will recommend that you be seen and being evaluated for other reasons or etiology for the cough that you're experiencing. So that is the update on the chronic bronchitis versus acute bronchitis, the video that I did 6 months ago. I'm just giving an update of that. So I hope this was helpful to you. So share this video with your friends, subscribe to my channel. Let's, take our health serious, because like I said, in the 21st century, you are actually your own doctor. So you have to do your own research. And when you see a doctor, you can ask the questions so that you and I can live a healthy life. So I'll see you on my next video. I'll bring you some more updates. All right.